we just decided we wanted to get back to the Midwest. My wife and I are both from the Midwest. She's actually from this area. She was born and raised in Granite City. From our perspective, from medical oncology perspective, we follow certain guidelines that are promulgated by large organizations. For example, there's a large organization called NCCN, and these are a group of about 20 large institutions, and their guidelines are issued for treatment of all types of malignancies. In other words, not just breast cancer. So they'll say, for example, that a particular type of breast cancer, these are the choices as far as options, what we feel our options are concerned. And we always adhere to those guidelines. So yeah, I do believe that, that patients can not only be diagnosed close to home, but they can be treated at home as well. There are many conversations that take place between myself and the surgeon, or myself and the radiation oncologist. When all that's done, then we have to, and if we decide that there's going to be some type of systemic treatment, then I now have to coordinate things not only with the surgeon, what are you going to do the surgery, when are you going to do the surgery, but also the radiation therapist. When is the radiation therapy plan? When is if they're going to get chemotherapy, when is the chemotherapy plan? But as you probably can imagine, this isn't our first rodeo, so to speak, and so we almost always know what the other person's going to do for the most part, but not always, Well, the number one is I have cancer, and it's a scary term. The first thing you have to recognize that every woman is different. Don't try to categorize into a specific group. And I think you have to be able to listen to what their concerns are. After seeing patients, I always try to have a conversation, the last part of the conversation of a visit, even if it's only a couple minutes, talking about perhaps something else. Something happened in our lives or their lives or interests that they have. And that last couple minutes is different depending on the stage in which you're seeing the patient, as you might imagine. A patient that's coming back for an annual follow-up. I have some that have been coming back 30 years. And they'll be asking, so, well, what's Emily, that's my oldest daughter, what's she doing now? So they've become friends, and I know about their kids as well.